would be no.
No, it goes
Right.
from hitting the site.
So, right? X-rays hitting the DNA is direct action, and we
yeah.
said that is not what low LET radiation does. It is X-rays hitting the cytoplasm, the water, creating free radicals, and the free radicals attack the DNA. So let's see. After we talked about free radicals, what else did we discuss? Ah yes, we discussed types of DNA damage. Right. So back in even semester 1, we had already started talking about things like your main chain scission, your cross links, and your point lesions. And so now we got to talk about them in more detail. So main chain scission, we said, could take the place of single strand or double strand breaks. Between single strand and double strand, which one is more dangerous to the cell?
Double strand.
Double strand, very good. If I wanted to snap a chromosome into pieces, would that be considered a single strand or a double strand break?
Double strand.
Double strand, very good. So if I want to take a chromosome and just like break it apart, just like snap it in half, that would be a double strand break. Okay. If I have high LET radiation, like alpha particles, what kind of breaks am I most likely going to see? Single strand or double strand? So high LET alpha particles would be double strand breaks, right? They're more damage, right? Alpha particles do more damage, so they do double strand breaks.
But they don't
Right,
get inside.
if they can reach the cell.
So would it be right to say, because they can't reach inside mostly?
No. If I'm asking you what damage alpha particles are going to do, you assume alpha particles are reaching the cell.
Oh, you just automatically.
Yes.
Okay.
Right.
Thanks.
Mhm.
And that's a double strand.
So that's going to be double strand break. Yes. So don't say something like, "Oh, how much damage? How do alpha particles damage the cell?" They don't. They can't reach the cell, right? Do not. If I'm saying how did they damage the cell, assume that they're actually reaching the cells. Okay. As far as covalent crosslinks go, we talked about 2 types. We said that the crosslinks can be intra-strand, intra meaning within, so same strand, or it can be inter-strand, right? Between, very good. So between our 2 different strands. Great. We talked about different types of chromosome damage. So we said chromosomes, when they get damaged, they can heal themselves. That's called restitution. Chromosomes can lose information. That's called deletion. Chromosomes can change shape. So this is rearrangement. Right, so we talked about restitution, deletion, and rearrangement.
Talk about a lot of stuff.
So these other names
Yeah.
are written in the slides.
This is the slide, yes.
It has that other names that you're mentioning.
It's not different names, it's just restitution does healing.
Restitution does what, sir?
Restitution is healing, right? The chromosome fixes itself, so that's restitution. Deletion, right? It loses information, right? It loses information, loses part of the DNA. And broken and rearrangement, right? It just changes shape. Instead of a nice straight chromosome, it's now a circle, for example. We talked about target theory. Target theory, another old concept we've talked about for quite a while. The main target molecule, the master molecule is what?
DNA.
DNA. Right, so damage happens to the target molecule, the cell dies.
Yep.
Right, that's the idea behind this. And then finally, we talked about different effects of irradiation to the cell. And so this is where we stopped last week. So let's just go over this briefly. So different things can happen to the cell. This is in order of most severe to least severe. Most severe being instant death. There is so much radiation, it literally shreds the cell apart. Right? The radiation breaks up all the chemical bonds, the cell turns into dust, right? And so it breaks up the DNA, the cell is shredded apart, the cell clumps together, creates the proteins are just everywhere, they clump up, they coagulate. So instant death requires a lot of dosage, okay? It requires like 1,000 gray delivered very quickly if you want to just shred apart a cell. So more often than not, we are not just blowing up a cell with radiation. That's not what's happening because we don't see such high doses. Okay. Now, if you're doing like radiation therapy and you're trying to blow up a cancer cell, then yes, right? This is when you might see something like that. But more likely, we are going to be seeing reproductive death of a cell, which means the cell is still alive, but it can't divide anymore. So once the cell dies, that is it. No more cell, no more new cells. Reproductive death. To cause reproductive death, we only need a dose of between 1 to 10 grays, depending on the type of cell. So the cell can continue to do its function, it's still alive, it's still doing its job, it just can't create new cells. It's like a sterile cell in a way, right? It can't create more baby cells, okay? So keep in mind, right, once again, this is specifically on the cellular levels. Nothing about the entire organism, it's just the cell, single cell itself. Yes, Reagan.
I'm sorry, I'm not sure if you said this already. What's the T stand for after the gray?
That is gray for tissue. Right, so this is specifically the absorbed dose. This is not air kerma, which is gray in air. Right, this is absorbed dose gray in tissue. Yes?
I thought it was time, like over a period of short amount of time.
Tissue.
Is that
It
is
says,
the
welcome.
effective
does
dose,
each
right?
cup of tissue have a number? Like,
Yeah.
like you know, like if I
It's T,
use
it's
like,
effective dose.
I don't know, liver, does it gotta have a number?
So if we start looking at effects to individual organs and individual tissues, that is when we need to get into effective dose.
Okay.
Because effective dose will take your whole body dose and tell you how it affects each individual organ and tissue.
See, I was listening to some-
So this is just whole body dose. So if your whole body, right, receives 10 grays, right, then you're gonna start seeing reproductive death in your cells.
So would you put the 10 where that T is, or that T just stays?
The T just stays with the
Okay,
gray.
okay, so we don't, okay.
Yeah. So the T is just to specify when I'm talking about grays, it's the absorbed dose version of grays, not the air kerma version of
I
grays.
understand. I don't know why in my head I just thought I'm gonna have to replace the T with the tissue, the number with the tissue.
Ah,
That's
I
why I
see.
was thinking.
Okay. Oops. All right. So, we also have apoptosis. Other names for apoptosis are programmed cell death, right? It's cellular suicide. It's also called interphase death because it takes place during interphase. So the cell basically commits suicide after exposure to radiation. The cell receives radiation, it's like, I'm injured, I'm heavily damaged, I feel myself changing, I'm turning, I'm gonna become a zombie. No, don't let me become a zombie. Take me out before I turn on you guys, right?
Also, just wanna just
Yeah,
don't
it just wants to die
before it turns.
it turns cancerous, exactly.
Have you filled this in?
So it kills itself.
It kills itself, yes.
Oh man.
Dang.
Right? So, right, it takes one for the team, right? The cell takes one for the team.
I guess.
Oh
Okay.
wow. Okay.
So the cell realizes that it either is no longer functional or changes have happened that makes it dangerous to the body, and so the cell tries to commit suicide to keep itself from endangering the rest of the body. So this requires a few gray, okay? Single digits for your more radiosensitive cells, double digits for your less radiosensitive cells. Some things to note about apoptosis. In this class, at least, we're talking about radiation-induced apoptosis. Cellular death or cellular suicide caused by radiation. But there's a lot of different things that can actually cause a cell to undergo apoptosis, not just radiation. Okay, but we're gonna focus on the radiation aspect. And then just like with cellular death, when a cell dies, it creates blebs, right? These are like fragments of the cells that remain. Yes,
So,
Shaheen.
what is meant by programmed cell death?
So this is the cell intentionally killing itself. So
the cell is programming itself to die.
so the cell is programmed to kill itself when certain things happen.
Oh, I see.
Okay, it is part of the cell's DNA instructions to be like, when this happens,
You have to.
kill yourself before you can cause the body to take more damage.
Thank you so
Right?
much.
If only everyone in zombie movies was this dedicated.
They gotta take out 2 or 3 more like main characters before they do it.
Yeah. Okay. So, moving on. Now we're getting into the less severe effects of radiation exposure. So here we have mitotic death. In mitotic death, it's similar to reproductive death, but not as extreme. Reproductive death is you cannot divide anymore, no more mitosis. Mitotic death is you can do mitosis a few more times and then you can no longer do mitosis. Right? So the cell dies after 1 or more cycles of cellular division. So you can reproduce a few more times, but then you die off. So it's not as severe, the cell does live longer, right? Which means the dose required for this is going to be small. It's lower than apoptosis. So once again, single digits. Okay? Single digits of exposure. Yes, Cody.
So the cells that I guess are made before that specific cell from the beginning dies off, are they gonna go through that same process too?
That's a good question. I'm not 100% sure. I would say that it would depend on the status of the cell, right? Because the cell is able to check its own status, so if it can tell that it's in a healthy state, it might be able to keep going. If it can tell that it's still in a bad state, then it might die off as well. Okay, now even less severe, mitotic delay. In this case, it can still do mitosis, it just takes longer, right? There's a pause before mitosis occurs now, right? So it takes damage and it's like, okay, I need to heal myself before I go through mitosis, right? So it takes a longer time, right? It takes time to heal itself, takes time to bring things back to normal, and then it resumes mitosis. So the cell just doesn't divide like normal. It waits longer before dividing.
But it doesn't die.
It does not die. Cell is still alive. Okay, so as we can see, right, low dose, right? So this is a really, not a very severe effect, right? It's kind of mild. So the dose to cause this is also a low dose. And finally, interference with function. This also happens at low doses. It's just radiation hits the cell and it damages proteins or things like that. And now the cell isn't able to carry out its function properly. Okay. Oftentimes this is temporary because we can rebuild the structures and then the cell proceeds like normal. Right? We have repair enzymes, fix the cell up, proceed like normal. If there is permanent loss of cell function, then the cell just ends up dying later on. It doesn't do its job anymore, it just dies. Okay. And so that brings us to the cell survival curve. This graph is important because this graph shows you the difference between low LET versus high LET radiation and how those radiation types have an effect on the body. So this information was determined through experimental data, right? We collected data, we did experiments with animals. This is what we got. Anytime you have a graph, very important to pay attention to what the axes represent. So here we have an x-axis, and the x-axis represents dose. The y-axis, you'll notice in this graph, points downward rather than upwards. And the reason is because for our y-axis, we're starting at 100% and we're going lower. Okay, so that's why our graph points downwards. And the y-axis represents chance of survival or percentage of survival. So if I have a whole bunch of cells, what percentage of them will survive a certain dose? Does that make sense? So that's why this is a cell survival curve. We're looking at what percentage of cells survive a certain dose. And now we have two lines. One line for X-rays, one line for particles. And when we say particles, it's something like an alpha particle. So particle radiation, particulate radiation, is this high LET or low LET?
Alpha is high, so it's high LET.
High LET. X-rays, high or low?
Low, sir.
Low LET. Great. So now we can see the difference between high LET radiation and low LET radiation. And what you may notice between these two lines is that this line is relatively straight. This line is
So linear.
curvilinear, right? It's got this curved portion first, and then
And
it
a straight
becomes
line.
straight.
Yeah.
Okay. So, you guys
Linear?
talked about this kind of in rod protection, like curvilinear versus linear?
Yeah.
Okay. Don't quite remember? That's okay. We'll go over it again.
I'm just here.
You're just here. Oh. Hopefully you're more than just here. I appreciate your presence anyway. Okay. So, what does this mean, the fact that this line is straight?
Linear.
Well,
It is
And
because
it's true, yes.
that
So direct relation, exactly. So, I have a dose. That dose caused 90% of my cells to die off. Only 10% remain. I give another dose, same amount,
Yeah.
that causes another 90% of the
Yeah,
cells to
so
die
it's
off.
directly
Now only 1% remain, right? So it's directly proportional. It's perfectly even, right?
Yeah.
I give dose, effect happens. I give dose,
Right.
same effect happens. So, perfectly straight. However, for our low LET radiation, here I give a dose, small effect happens.
Yeah.
I increase the dose, a significantly bigger effect happens. I give a dose, an even bigger effect happens. So, it's not perfectly directly related.
Conditional.
Right? It's,
Really
yeah, it's conditionally, right? It's like
Right.
I increase, and at the beginning when I increase, only small changes.
Uh-huh.
And then once I increase a little bit more, I see
Bigger
bigger
changes.
and bigger and bigger and bigger changes now. And so the reason for this is because of healing. When you have high LET radiation, the cell has difficulty healing. So you don't see any effects of healing. It's just damage, 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 damage all the way down. But here with low LET radiation, the cell is able to heal. So you cause damage, but then it heals. You cause damage, but then it heals. So the overall effect is that there's actually not a lot of cell death happening here because the cell is able to heal at these low doses. But once the doses get high enough, that's when we see cells start to die off faster and faster and faster.
It kind of reminds me of like an athlete when they play sports
Mhm.
and it's gonna hurt, and then they keep playing and it's more damage, and then they keep playing and then they, you know, like
Yes.
and then eventually they're down.
Right, exactly. It's just like that, right? So if you're exercising or you're playing a sport, right? As long as you take breaks and give your body a chance to rest, recuperate, heal, right? You don't see that much damage. But if you're constantly pushing your body, right? That damage begins to add up, no time to heal, and then eventually it becomes something major.
It's like our brains from the last 2 years. At least mine did. I don't
That's
know,
a
pretty much.
that's also a good analogy. You've made me think of this in a completely different light. Thank you. Okay.
I started out at 100. I'm in the 1% right now.
1% right now.
Barely. I have the 1% class me until May.
So once more, right? X-axis dose, y-axis survival rate. You may notice the y-axis is a bit funny. This is called a logarithmic scale, so it doesn't go like 1, 2, 3, 4, 5 evenly. It's 100 divided by 10, 10 divided by 10, 1 divided by 10, right? So it goes based on multiplication and division rather than addition and subtraction, right? So this kind of scale is called a logarithmic scale, right? And so this flat part, this part where we see the healing happen, right? This kind of horizontal section of the curve, this is what we call a shoulder. So you have this shoulder where we're healing, 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 Then once you're past the shoulder, that's when we just see straight damage. Yes?
For the
Angelica.
registry, what do we have to do?
So for the registry, no. X-axis, dose. Y-axis, survival, high LET radiation, no healing, low LET radiation, has healing. The healing section portion of the curve is your shoulder.
Which
Actually-
kind of makes sense, because you think the shoulder goes this way,
Mhm.
and then it.
And then it drops. Exactly.
You said when it's past the shoulder is now damaged?
So yep. So
Okay.
yeah, shoulder, right? It's flat because we see effects of healing. But once we get past the shoulder and it's a straight line, that is just pure damage.
Okay.
Mhm.
Right.
Alright. Okay. And so you also see this neat thing here, RBE. What was that again?
Relative.
Relative? Mhm.
Yeah. Relative biological effects.
Effectiveness, that's right.
Yeah.
So if I have a type of radiation here, my particle, and I compare it to my 250 kVp X-ray, I can say, hey, in order to kill off 90% of the cells, I need only a low dose for this radiation. I need a much higher dose for my X-rays. So I can now describe this radiation as, oh, this is so much more dangerous than X-rays using my RBE. So this is actually how we can tie RBE into this as well. Yes, Shireen?
So the linear lines are more damaged since it's direct.
Right, so the
Right.
linear lines represent just pure damage.
All right, gotcha.
Mhm.
So the curvier the line, the least amount of damage it does?
So the flatter the curvy
Flatter,
part is.
flatter.
Mhm.
So when you say D X-ray, D particle is instead of a figure, right?
So D is dose,
Dose X-ray.
right? So RBE, right, is dose of your X-ray, which is your the thing you're looking at. Oh, or sorry, your what is the word? Your reference. So dose of your X-ray is your reference dose, right? Your 250 kVp over dose of the whatever X-ray you're or whatever radiation you're trying to measure. In this case, the particle.
So on a test, how would you ask a question?
Mhm. So I could give you an unlabeled version of this graph, ask you about the axis. I could ask you what the curved part is called, which is the shoulder. I could ask you like which line is going to be which.
And are they always gonna be like that particle and then X-ray?
Mhm. Right. So I could, it's a particle and may have like high LET, low LET.
Okay.
Right? But same idea.
Thank
Okay, Mr. Phung, I see you coming through this semester. I like this.
So I never came through the previous
I mean,
semester.
you have, but I don't know.
Okay.
I like this version.
Yeah, I like this too, Mr. Phung.
Okay, some more vocab for us to know. Cell maturity and specialization. So, we have immature cells, which are considered to be non-specialized and undifferentiated. We have mature cells that are specialized and differentiated. So, easy way to think about this, right? Immature is like a kid. Kid doesn't have a job, doesn't know what they're going to be doing, right? They're unspecialized, right? Non-specialized. They're undifferentiated, right? All the kids look the same, right? You might think your kid's special, but your kid is special,
I was gonna say.
but all the other kids look the same, right?
Andrew.
Right? Especially if they're like going to one of those schools where they have to wear the same
With same
Oh,
uniform and
yeah.
everything.
Oh, my God.
Right?
Especially
Undifferentiated.
especially
No
the
differences.
fish, sir.
Right, so mature cells, right? This is when they're specialized, they have specific jobs, right? This is when they get to show off their personalities by choosing what to wear, right? So differentiated.
So this is the law.
Yeah, so right now you guys are immature cells, right? Because you're all wearing the same uniform. But as soon as you graduate and you go to the workforce,
Mature.
you're ditching those black scrubs, and
Yes,
you're gonna be
burning.
wearing the rainbow,
Never
right?
catch me in a set of black
Burning them. So
That's right.
this is the law of B and T.
Yes, this is the law of B&T.
Tribunal,
Burgundy and Tribunal. Yes.
Burning.
Burgundy.
Sanders.
Not burgundy. Burgundy. Like
and Tribunal.
Burgundy?
it's kind of like burgundy, yes, without the D.
Burgundy.
Yes, burgundy without the D.
When you
Burgundy.
said the last word, all I thought about was
Okay, so maturity, specialization, these determine how sensitive a cell is to radiation. Same thing for oxygen, and same thing for reproductive activity, how often the cell divides. right? So the law of Burgundy and Tribendo kind of covers this, where it's like, okay, if you have an immature cell that's rapidly dividing, it's going to be more sensitive. If you have a cell that's more mature, it doesn't divide as often, it is less sensitive.
What was the immature ones?
Oh, sorry, immature is non-specialized, undifferentiated.
No. You like for mature, you said they doesn't divide as often.
Oh, yes, so immature will divide more often.
Okay.
Mature divides less often.
All right. Thank you.
I mean, you know, it's like younger people, they've got more energy, right? Older people, less energy.
Divides very often,
More often.
Yes, so immature usually will divide more often.
and mature will divide.
Less
Doesn't
often.
divide as
But generally speaking.
Oh, don't get the
There's going to
adjective.
be exceptions and stuff, but don't worry about the exceptions.
General.
All of these rules are generally speaking.
This is not like for cell division. If the mature, the cell divide more. Right?
Okay.
It's not like that. It's not relating to cell division.
So we are talking about cell division. But here's an example of what I mean by mature versus immature. An immature cell, as an example, would be a stem cell. Stem cells are immature. They are they're undifferentiated. They're not specialized, but they're non-specific. That's why stem cells are such a big field of research that we want to go into, because if you've got a cell that can become anything, you can take that cell and grow it into a new liver, a new brain, a new heart, right? So stem cells can become anything, right?
It's a big deal.
They are, yes, very big deal. So they're undifferentiated, like they're non-specific. So we have a stem cell. In this case, this stem cell is called a multi-potential hematopoietic stem cell. You don't need to know the name. I'm just using this as an example. But this just tells you it's got a lot of potential, and this is going to be used to create blood cells, hematopoietic.
So they're
creates blood
hyper.
cells.
They're like hyper since they're
So
immature
yes.
the kids, right?
So these are going to divide. So these are going to divide.
Okay.
And then after it divides, some of those are going to mature. And now they're going to, as they mature, they begin to split into their specializations. Right? So this one here is like, I want to be a myeloid progenitor. And this one's like, well, I'm going to be a lymphoid progenitor. Right? So they're starting to choose different jobs. And from there, they begin to keep dividing. And as they divide, some of those become more mature. And from there, it's like, all right, I'm going to be a megakaryoblast, or megakaryocyte. And then from there, it becomes a platelet. Or I'm going to be a red blood cell, an erythrocyte. I'm going to be a myeloblast, and turn into all of these possible white blood cells. Right? And then on the other end, it's like, okay, well, I'm lymphoid, so I'm going to turn into a natural killer cell. Right? Or I'm going to turn into these lymphocytes, T lymphocytes, B lymphocytes.
Those are the psychopaths.
Yes, so natural killer cells, they're the white blood cells that actually like hunt down cancer cells and things like that. Yes, the psychopathic cells.
So is this a chart that we should know?
No, this is just as an example of maturity and specialization. Immature, non-specialized, highly mature, highly specialized. That's all I'm showing you here. You do not need to memorize like basophils and neutrophils and eosinophils. I mean, it's really nice if you would. I think it's really exciting. You might know that like eosinophils help you fight off parasites. Right? That's really cool. But you don't need to know that. It's just extra information if you really care. But law of Burgundy and Tribendo. So radiosensitivity of cells, directly proportional to their reproductive activity, inversely proportional to their degree of differentiation. What this means is that the more it divides, the more radiosensitive it is. The more mature it is, the more of a job it has, the less radiosensitive it is. So that means the most radiosensitive cells are cells that divide very often and that are immature, that have not chosen a job yet.
Can you repeat that? The more it divides, the more.
The more it divides, the more sensitive it is to radiation. And then the less mature, right, the less it has differentiated, the more it is affected by radiation.
Okay, I got the first part. What's the
Yeah.
second?
Okay, so one more time, right? So talking about differentiation, right? Its job. If it's at the beginning, it has not chosen a job yet, it is more affected by radiation.
Okay. And the second part?
Well, that was the second part. Yeah, so second part is about the job. First one is about division. Right? Divides fast, affected by radiation. Doesn't have a job, affected by radiation.
Oh. So that the immature cells are basically more radiosensitive?
Right, so immature cells are more radiosensitive.
Wait, oh.
Yes, John.
So more responsibilities, less radio sensitive?
Yes. Okay.
Mr. Phung,
Yes.
this has had the longest phases.
Mm-hmm.
Is that talking about each individual phase in one mitosis, or is that just like it goes through mitosis over and over and over and over and over?
It spends the amount of time it spends in mitosis.
Okay.
The more time it spends in mitosis, the less time it spends in interphase, the more sensitive it is to radiation.
Okay.
And that makes sense because if most of your time is spent in mitosis, that means that you're going to be doing lots of division.
Oh, that makes sense. So the kids are more sensitive.
The kids are more sensitive, even in terms of cells, right? The
Okay.
cellular kids are more sensitive than the adult cells.
Okay, gotcha. Bad.
So there is a caveat, like an asterisk here. So the book mentions that as far as this goes, modern thinking is now that it's not the fact that it divides often that makes it radiosensitive. It's the fact that it divides often that the effects of radiation are more obvious. Because if radiation damages something and the cell divides, those new cells carry over the damage. And if more radiation comes in and damages those cells, well, the damage just multiplies. And so the effects of damage are more obvious in cells that are dividing rapidly. But that's a distinction I don't think you need to worry about. Okay? It is mentioned in the book, so I'm throwing it out there in case you read it and get confused. But don't worry too much about that distinction. This is good enough. Right. Next up, lethal dose. All right. Not exactly a fun topic, but also kind of a fun topic. So the thing to know about lethal dose, the key thing, right? If you know anything about lethal dose, make sure you know how it is written. It is written as lethal dose number over number, number/number. And you need to know what those numbers mean. What does the very first number tell you?
50 people.
Not
50%.
Oh, sorry.
50%, right. So this tells you the percentage of the population that will die. So if I'm looking at lethal dose 50, I'm looking at the dose that causes 50% of the population to die. If I'm looking at lethal dose 20, I'm looking at the dose that causes 20% of the population to die. So the first number is about what percent of the population dies. So then, what is the second number?
The days.
Right. The days, time, duration. How long we wait before we check. So we are saying LD 50-30. 50% of the population dies within 30 days. So if I wait 30 days and I check the population, half of them should be dead from this dose of radiation. Okay. If I have LD 50-60, okay, well, instead of 30, I now have 60. What's the difference?
The days.
Double the
time.
days.
Days, the time.
60 days for them to die.
Right, so I'm looking at 60 days. Okay, after 60 days,
Then
how many people died? Well,
50%.
half the population, 50%. So imagine that I said I have 2 doses. One dose, right, gave me LD 50-30. One dose gave me LD 50-60. Which dose do you think is more dangerous?
The first
30
one.
was
30.
the one that was 30, sir.
30.
They out there 30 days.
30, that's right. Because just killed the same number of people, right, 50%, but it did it much faster, right? So this would be a lot more dangerous, LD 50-30. So LD 50-30 has, for a long time, been the main standard way to describe doses, right? So it's like, okay, this is the dose that will cause half the population to die in 30 days. But nowadays, because medical treatment is just so much better, we're able to keep people alive longer. So they survive those 30 days. So now it's easier for us to talk about how many people die after 60 days. That gives us a better idea of what the effects will be, right? Taking into account all of that medical treatment. Yes, Shahid.
Sir, you used the term, I didn't follow what term you used. Before 50-30 you used the term.
I do not remember.
Oh no, is there anything that we need to know about the 50?
So just 50 is your percentage, right? So percentage of your population, and then
30
afterwards is the
Time.
how long it took for this effect to happen. Yes, John.
There's also LD 50-50, right?
Yes, you can do LD anything. So using John's example of LD 50-50, if I said LD 50-50, what does that mean?
50%
50
dies in
days.
50 days.
50 days.
50% dies within 50 days. Yes.
But it's always going to be days. It won't be changed to years or.
Correct. The last number needs to be in days. If you want to do a longer time period, you just have to express it in days. So if you want to do like half a year, it would need to be like out of 180 or something like that. So for example, if I said LD 2040, JB, what do you think that means? LD 2040. What does that 20 mean?
20 would be the percentage,
Mm-hmm.
and you say 20, 30,
Mm-hmm.
in 30
Tw-
days, they.
Or sorry, 40.
40, but in 40 days, 20% would be dead.
Very good. So in 40 days, 20% of the population would be dead. Very good. LD
40
2040.
days and 40 nights.
So on the exam, I'm just gonna give you a random LD something something, and I'm just gonna ask you like, what does this mean? And so you need to find, oh, this number percent survived, or over this many days, or this number died over this many days, right? Those would be like your answer choices, and so you need to choose the correct one. And right, I might be tricky, I might swap them around. So I might talk about the time first and then the percentage. So don't let that throw you off. Okay? I'm warning you. I'm warning you ahead of time.
So you can put 30, how can you put?
So I can say, okay, LD 50-60. This, all right, let's use LD 50-30. 2 possible answer choices for LD 50-30. LD 50-30 means that after 30 days, 50% of the population has died. Or after 50 days, 30% of the population has died. If you're not paying attention, you see, oh, 50 goes to the first 50, 30 goes to the second 30, and you might mess up and say, 50 days, 30%, right? Don't let that happen. Make sure you match percent to the first number, days to the second number.
Usually 50 always come first, right?
Usually, but I can switch up the description.
Oh,
So be careful. Jay.
So this is with regard to any sort of radiation, not just X-ray or.
Any sort of radiation, yes.
So like, if they were measuring, let's say, the radiation levels in like Hiroshima or.
Yeah, exactly. So nuclear disaster, nuclear bombing, right? We could also use this concept to talk about it.
Because this is general, correct?
That's right. This is just about dose in general.
Cool.
All right, we're almost done.
Okay.
So, effects on blood cells. This is going to be important because this will pop back up again next chapter as well. Next chapter, we are going to talk a lot about blood. So, blood.
You said this gonna be on next chapter.
Next chapter. We're going to see this next chapter again when we talk about the hematopoietic effect.
Oh, okay.
The
Yeah,
what?
yeah.
The hematopoietic effect. Hematopoietic is a very fun
Like
word to say.
hematology.
Exactly. So, one of the big things to know about radiation exposure is that it will decrease the number of immature blood cells in the bone marrow, right? Because your blood cells, your red blood cells, your white blood cells, come from the bone marrow, right? You have basically blood cell factories in your bone. And of course, the blood cell factory is just all these stem cells, these immature cells, dividing and creating new blood cells. Radiation will reduce the number of stem cells. It reduces the number of immature blood cells. And that will have an effect on the number of total blood cells produced. Right? So if you destroy the factory, you don't create as many blood cells, and now you have a problem. So a whole body dose of 0.25 grays is enough to reduce the number of blood cells in circulation by a measurable amount. You can actually see a drop in the blood count when exposed to 0.25 grays of radiation. If a relatively low dose, so 1 gray or lower, is received, you will see a loss of these immature blood cells in the bone marrow. And then it will take several weeks, right, for those blood cells to come back. The higher the dose, the longer it takes for those blood cells to repopulate.
So at 1 gray, right?
Mhm.
1 gray of tissue.
Yes.
Let me say that. If that's received, the repopulation of bone marrow cells occur within weeks of exposure. So you're gonna lose, you're gonna see a loss, right?
Mhm. Yep.
At that amount.
Yep.
And then it will take a few weeks for it to climb back up to
Exactly.
normal cell count.
Yes.
Okay. Just asking.
Okay. So, this next part, very, very important. Does anyone know how long blood cells live? That's right. 120 days. But for what kind of blood cell?
Red blood.
Red blood cells.
Red.
What about the other blood cells, like white blood cells?
We don't like them.
30 days. No.
Like 4 days to a week?
Oh.
White blood cells are very, very short-lived.
Oh, is that why? Okay.
So,
Is something
when
like
exposed to
that?
radiation, the concern is not, oh no, I'm gonna lose my red blood cells, there's nothing to carry oxygen, and my body's gonna die because
It's the right.
oxygen can't get to the body. Right? No. Because red blood cells last so long, when you see a loss in the stem cells, it does not affect the red blood cells very much. Your red blood cells are still pretty much fine. You can still carry on carrying oxygen. The big impact to your body when you receive radiation is to the white blood cells. You will see a massive drop in the white blood cell numbers, and when you do not have enough white blood cells, what happens?
You get
Fight
sick.
off infection.
You
That's
get
right,
sick.
you get sick, you get infections, right? So that is the big danger from radiation exposure to your blood cells. Okay, it's not about red blood cells. Red blood cells usually are fine, right? They're usually not the cause of death from cell depletion. It is your white blood cells that are primarily affected. And then after that, platelets. And finally, red blood cells. Okay.
Wait.
So, as an example, lymphocytes, white blood cells, their lifespan, 24 hours. You have to reproduce your lymphocytes every day. Right? Every time you go to sleep, you wake back up, brand new lymphocytes. Right? You go through your Friday, go to sleep, wake back up, brand new
Monday.
lymphocytes on Saturday. Right? You're not doing shifts, right? You just die off and a new batch comes in. So,
You have to sleep, sir?
I hope you sleep.
No, but you don't have to sleep, right? Is that like,
You have
They're gonna switch jobs whether you sleep or not.
No, I was
like,
gonna say,
that's
let
what
me
I
know.
mean. So it really,
Try to let me know.
it's suppressed.
You can't keep your white blood cells alive by not sleeping. I'm sorry, it doesn't work like that.
She's like, but I'm still here.
Okay. So,
They don't they die?
white blood cells are important, right? Because they produce antibodies, because these are proteins that help fight disease. Short lifespan, so constantly need to be replenished. If we have radiation, right, we will see a drop in our lymphocytes. Now, as long as the dose is low, we'll recover them relatively fast. But if you have a really high dose, right, so we said earlier that after a dose of 1 gray, it can take weeks to rebuild our blood cell factories, right, to rebuild those stem cells. So because of that, it takes a long time to rebuild the lymphocyte count, right? It can take months to recover the lymphocyte count, just because there aren't enough stem cells producing them at a dose of 1 gray. Does that make sense?
Yes.
Okay. So key takeaways so far: red blood cells, not the main impact from radiation. It's white blood cells like lymphocytes, or white blood cells like neutrophils. Okay, so neutrophils also short lifespan, right? Only about 5 days or so, 5 to 6 days. So they last less than a week. They also need to be replenished regularly. Same number right here, right? 0.5 to 1 grays, right? You can depress them, and it takes months to recover. Yes, Cody.
I think I just missed it. What does depressed mean? Like,
So depressed just means lower.
okay, just lowers. Okay.
So we just lowered the number of white blood cells. Okay, thrombocytes, platelets. So these last longer than white blood cells. Okay, they have a lifespan of about 30 days. So that's not too bad, about a month. But still, with enough dose, right, we can see the numbers go down, and it takes time to climb back up. So with white blood cells, we said, all right, dose was about 0.5 to 1 grays. It can take a couple months to recover. Here, now we're dealing with higher doses. Right? In this case, doses of 1 to 10 grays wipe out the stem cells, and then it takes a long time to recover our platelets. While we're missing platelets, it's going to be hard for the blood to clot. So constant bleeding. Yes.
I have like low platelets. Could it be because of the radiation?
Is it something that's chronic?
No,
It's something that's acute. It just happened.
it does happen.
It just
after
happened.
after the program, actually.
Dang, John.
It shouldn't be, right? Because you've seen your radiation monitoring reports, and you did not receive anywhere near this level of radiation. You haven't even received this level of radiation.
What else could be
So-
reason for platelet drop?
It
There
still
were a couple
could
people.
be due to radiation, just not radiation that you received while wearing your monitoring badge.
Yeah.
So maybe you've got some other radiation source near you at home that's not near your badge that's irradiating you. Or maybe it's just, I don't know, your diet or something. You're not producing as many platelets.
That is true.
By the way,
Thanks, Ron.
you guys have a ton of platelets in your blood, right? In 1 cubic millimeter of blood, right? In 1 millimeter of blood. Even John's, right? He might be on the low end, but even in 1 millimeter, you have over 100,000 platelets, right? 150 to 350,000 platelets. And if you think of how much blood you have in your body, we're dealing with like billions and trillions of platelets, right? It's kind of insane to think about, but there are just that many platelets in your body. All right, moving on. So, how do we monitor effects on blood cells? We monitor effects on blood cells when we expect high doses of radiation to a person. So, if a patient undergoes a procedure with long fluoro times, right? So like IR, cardiac cath, something like that. We may see some small changes to the number of blood cells, just because the doses in fluoro end up being high when you have really large amounts of fluoro happening. We may also need to monitor the number of blood cells when dealing with therapeutic radiation, right? Radiation therapy. So blasting cancer cells with radiation, well, radiation beams still need to travel through the body, they still need to travel through bone. So we still need to check blood counts for those patients as well. Okay. So to do that, we do CBCs, right? Complete blood counts, to monitor the level of various blood cells in the blood. Now, for us, occupational exposure. Do we use blood counts to monitor our exposure? No. Why not?
Because we
don't
get
get
blessed.
enough. We
We're not
should
getting
get
enough.
Exactly. We don't get enough radiation
We should not
to
stay in
see
the
an
front of the
effect in
primary
our blood
vein.
counts. By the time you see an effect in your blood count, it's too late. You've received way too much radiation. Right, so that's why we use OS cells instead, right, dosimeters. We don't use CBCs.
That's
Mr.
why,
Phung.
so you can measure it in quarterly, right?
So we can measure low doses.
Yeah.
Yes.
So, like, say for instance, a tech or someone gets a high dose. Like, do they have to be off of work for a while, or?
So it depends on the department protocol, but they might be moved into a lower radiation area. So let's say that at a hospital, they have, rather than like rotations, they have assigned locations. Like you're always the OR tech, you're always the portable tech, you're always the EC tech, right? That OR tech might eventually end up with high levels. They're like, okay, we're gonna pull you out of OR, stick you somewhere lower dose, right?
For how long?
Mm.
Until the end of the year?
Until
Until the end of the year. Yeah.
End of the year.
Really? Okay.
And so then it resets. Yes.
Yes.
You know, we in
Oh,
OR
okay,
and
you
we
said
have
it's
the shield on,
Mhm.
and we have those outside.
Yes.
Do that, take effect with the numbers?
So, so good point. You do want to make sure that your dosimeter is on the outside of your lead apron when you are in OR. And the reason is because, yes, your body, your gonads, they're covered by the lead apron, but you still have all of this here as well that is uncovered. And the point of the dosimeter is to measure the highest dose to your body. So, keeping it outside, make sure it gives you an accurate measurement of dose to like your face, eyes, hands, things like that. Even if your thyroid, chest, body, gonads might be covered. Okay, so they do take that into account when checking your numbers.
Mr. Phung?
Yes, Jay.
But even then, the lead shielding that we're wearing is only protecting us from 66% of the radiation, right?
Depending on the thickness and the kVp, yes.
Okay.
Got him.
I forgot where I was going with that. Proceed.
So just keep in mind that lead shielding is not a panacea. It is not a perfect solution. When dealing with radiation protection, you need to take all aspects of radiation protection into account. Not only should you be shielded, but you need to take into account distance and time as well, right? It's called time distance shielding for a reason. Not shielding, right? It's time distance shielding. So you need to take everything into account.
So I would just, technically we may be 6 feet away from
Mhm.
in OR, and we're dehaunted, and we're wearing a lead shoe, and we're wearing a thyroid shoe,
Yep.
so I can see us getting minimum radiation.
Yes, so yes, minimum radiation. Okay, as far as other tissues go, epithelial tissues, right? The inner lining of your body, right? Those tissues, like in your intestines and stuff. Constantly regenerating. What does it mean by regenerating?
Yeah.
It needs to be constantly dividing to reproduce, which means, are these radiosensitive?
Yes.
Yes, these are radiosensitive. Okay, fetal nervous tissues, right? So, for babies,
Definitely.
when they're inside the womb, right, when they're growing, those cells are constantly regenerating, right? Constantly dividing. And these are relatively immature cells. So also highly radiosensitive. Okay? The window of maximum sensitivity, in fact, is 8 to 15 weeks after gestation. Right, so this is within, I think, the first trimester, right, bordering on second trimester. Okay? Insensitive tissues, muscle tissues. So muscle tissues, they don't divide that often, and they have a very specialized role, right? They have their job already. So you're not gonna see these as sensitive to radiation. Okay? So you hear about things like, cancer in the intestine a lot more often than you hear about something like cancer in the muscles, right? And then nervous tissue. Okay? Nervous tissue also highly specialized, very rarely divides, or it divides very slowly. So once again, not that sensitive to radiation. It takes a lot of radiation to cause damage to the nervous system. And finally, the thing you've all been waiting for, reproductive cells. So, for males and females, you notice that the numbers are about the same. So 0.1 to 5 to 6. And then over here, 0.1 to 5 to 6, right? So numbers are pretty close.
Okay.
So you really only need to memorize one set of numbers for reproductive systems overall, right? Because they kind of apply to both male and female. So mature sperm are relatively insensitive. It's the immature sperm, as we're right before meiosis, right? They're constantly dividing. These are the ones that are most radiosensitive. Okay? And then of course the damage happens here, and then they mature. The damage gets carried over to the mature cell, and then that damage goes over to the baby after fertilization. So 0.1 grays to the testes is enough to depress, to lower the male sperm population. It is also enough to cause mutations in the sperm that can be carried over to future generations. So if a male is exposed to 0.1 grays to the testes, remember, not a full body dose, but to the testes specifically, right? That male should probably refrain from unprotected sex for like a month after exposure, just to make sure that the sperm have had a chance to cycle through. All of the exposed sperm are now gone, and you have new, fresh, healthy sperm. Right? That way you don't pass on anything weird to future generations. 2 grays to the testes, enough to cause temporary sterility for up to a year. Okay, a year of temporary sterility, 2 grays to the testes. Okay, 5 to 6 grays to the testes may cause permanent sterility. Okay. By the way, I do give you this information with the expectations you don't misuse it.
I'm sorry.
All right, I'm glad you got to do it. Thank you. So, yes, Cody.
So, what kind of situations would lead to someone getting that amount of radiation to that area? Would it just be like an OR case? Is that, but even
Right.
then, is that like?
So just speaking in general, if a patient receives radiation, just generally speaking, right, they receive radiation. They receive whole body radiation to the whole body, and then we can use our effective dose to calculate all of the radiation to the whole body, how much of that was concentrated in the testes. And then we can use that to determine what we just saw. Yes, Jay.
Would you also be able to do that from air kerma?
Air kerma, not as well.
Not
You need to be dealing with tissue dose, not dose in air.
Okay.
Like air kerma you can use to look at like exposure to skin. Right, we use that for our skin dose. But if we're looking at tissues, we want to be using our absorbed dose.
So even if we were in a, let's say, IR case for a long time, and at the end of the exam we say, 26.7 is the air kerma, that's more so for the patient, or is that for us to
Right.
know?
So that's going to be for the patient, that's going to be for like entrance skin exposure, as an example. Right, but that's not going to be for us because we were in the path of the beam. Only things we receive are scatter radiation, so our dose is going to be considerably different than that reading.
So we would need like a significant amount of scatter radiation to even come close to that?
Yes.
So that's mostly for the patient then.
So yes, a lot of this stuff, right, we're not going to see ourselves.
Needed to know
A lot of this stuff is going to be stuff that happens to the patient.
What my
Yes.
ratio, like,
As soon as they start shooting, I'm out.
yeah, for sure.
Oh wait, I have to do that.
We're
Okay,
about to do a run?
so
Watch for the win.
final part. All right, 2 more slides. So now that we've talked about the male reproductive system, let's talk about female reproductive system. So once again, we have the ova, right? Ovum for singular. This is the egg. This is the mature one, right? So insensitive. We're talking about like that oogonium, right? All the way at the beginning. That's going to be the immature one, unspecialized. So that would be the radiosensitive cell. Okay. If the ovum is damaged, conception can still occur, but once again, there might be abnormalities in the baby. Now, as far as female cells go, they are limited in number compared to sperm cells. So only 400 to 500 mature are produced over the lifetime of a female. Okay. And then as far as radiosensitivity, this varies based on age. And this is actually really interesting, right? I was actually surprised when I first saw these numbers because the least radiosensitive time is from 20 to 30 years old.
When you get older.
Really?
Like me, that's why I want.
So radiosensitivity actually increases as you get either older or younger from this 20 to 30 age range.
That's right.
So
I run, so as they say.
is that because we're rapidly going through like replication and cell division and all that good stuff? Like our body is
The book,
replenishing itself?
the book explains the idea behind it. I don't remember it off the top of my head.
Okay.
Yes, Cody.
But is this concept only applying to females?
Yes, only to females,
Okay.
not to males.
That's walking
Is there-
forward.
is
So
there
this
iron
is
man related to that?
So this says radiosensitivity decreases
Oh,
from
this is
birth
talking about
until around
the
30 years of age.
Yeah, I was like,
Yeah,
I was
but,
thinking about like just.
till 20
age
you
of
said,
female,
right?
yeah. Okay, I was-
20 and 30 is not very. So that should have been 20
You got
years.
wrong
No.
information.
It is what
Radiosensitivity
it says.
decreases from birth until around 20 years of age. Nisha isn't around.
So think about it, and if you're still
It's okay, so
confused,
I-
we can talk about it.
Alright,
later.
I don't, thanks. Sir.
Okay, finally, same numbers. So, 0.1 grays. When we talked about the testes, 0.1 grays to testes gave us what?
Temporary stability.
Not yet.
Oh, 2 is temporary sterility.
Depressed.
Depressed, that's right, depressed sperm
Oh.
count. Right, and possible mutations, right?
Yeah,
For the
so
baby.
that's why you wanna wait.
That's right. So same thing for the female, right?
Yeah.
So they don't have depressed egg count, okay, but they may get menstrual irregularities. And once again, advised to postpone from sex for 30 days until the damaged ova is gone, and then we have a new fresh ova. Okay, 2 grays,
Temporary sterility.
temporary sterility, same thing, right? So temporary sterility at 2 grays. Now, here's an interesting concept to keep in mind. I think I have it later as well in one of the other units, but I'm gonna throw this word out now just so that you get used to it. Fractionation. Have you guys seen the word fractionation in your reviews at all? Not yet, okay. So,
In lecture.
fractionation sounds like the word what?
Fraction.
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 So that means divided.
Right, so you have a dose. The effect of the dose is different depending on if you give it all at one time or if you give it in fractions, right, over a period of time. So a female can actually take up to 20 grays over several weeks,
Okay.
right? Because of fractionation. You take this dose, you divide it up into smaller pieces, give it over a long period of time, and you don't have major damage, right? You
So
still
when
have
you
just
get
minor damage.
And take 75 grays over maybe 4 days, every 4 days you get pulled 75 grays, you might not have temporary sterility till you reach the 2 grays, right?
Perhaps.
Okay, that makes sense.
Okay. And then just like with males, right, 5 grays per minute sterility.
Got it.
And
Can I
that,
say that word again? Fraction of what?
fractionation.
Fractionation. Got it.
Fractionation. Okay, and that is
That's the
it.
word. Remember that.
All right.
Fractionation.
Yay.